so much for being with us today. Oh, there's one more thing. I think I was going to do a slight housekeeping issue. And Audrey, correct me if I'm not right, which is that if you have a question during the presentation, go ahead and type it in. And they'll stop at different sections and pause a moment to answer them. Was there anything else? I think that was the main housekeeping issue.
No, that should be fine.
Okay.
Liza, just to get a sense of our audience, could you tell us a little bit of who's in the audience so we can see them?
You know, we sent this out to a very broad group within the Academic Collaborative of Integrative Health. We actually also sent it out to some of our consortium colleagues, but generally it will have been circulated to individuals involved in education, academic education, and also academic clinical practice. So that's generally the audience that we tend to attract, but there are also maybe individuals here from private integrative clinics, but generally focusing on educators, I would say, and clinicians.
Okay, thank you very much. And thank you for inviting us to present on this, like you said, very collaborative and exciting project that has been the National Center for Integrative Primary Health here.
Patricia, you have a little bit of an echo. I am so sorry to interrupt. So I'm not quite sure why. You might start again if you could.
Well, maybe if you mute your computer, or if not, yeah, if you mute your computer, it's because we're both have some.
I think you need to move closer to the mic.
Okay, closer.
Yeah, that's it. Audrey comes in fine, and so if you can do that, that would be great.
Is this better? Is this better?
Yes.
Yes, much good. Now we're on. Okay, great. Thank you.
All right, thanks. So again, thank you for inviting us, and a little bit about who are we, or what is this National Center for Integrative Primary Healthcare. This has been a collaborative project that we have done with the consortium of academic, the Academic Consortium for Integrative Medicine and Health. It changed the name in the process. And with HRSA, which is Health Resources and Service Administration. About 3 years ago, a call for this National Center Cooperative Agreement came on, and we were very lucky to be selected to do this project together with HRSA and the consortium. So the purpose of, the big purpose of this project is to advance incorporation of competency and evidence-based integrative health curricula and practices into primary care education and practice. So the area is primary care and preventive health care, and we wanted to concentrate on competency-based type of curricula, and we will talk a lot more about that as we move through the presentation. The three main outcomes that we had was, one, to create what we call the meta competencies. Different integrative health professions had work on competencies for their professions, but we wanted to try to create what we call meta competency, which is something that all professions could look at as where to start to develop competencies. I'll talk a little bit more about that. And then a core curriculum, which is the course, and I'll show you that. And the other big outcome or product is a website, which is a repository of resources for education and practice, and we'll show you that too. Next. So the 5 main goals of the project, one was to create a truly interprofessional leadership team. We think we started with the thought that integrative health is primarily collaborative. and wanted to incorporate all the different disciplines and professions that work in primary care, using integrative health as a model in this team. And we'll talk a little bit about that too. Like I said, we wanted to create the competencies, the meta competencies. We wanted to do the curricula, and then the other two things was the website. And in addition to the website, we felt very strongly we needed to create patient education materials, both for the practitioners, but also for patients to have direct access to something that they can understand in terms of how to incorporate integrative health in their care, in their primary care. And I'll talk a little bit more about that later. And lastly, we partner with a physician, an integrative medicine practitioner in LA, Miles Parr, who is creating a database for practitioners with that are available for underserved populations, and these are populations that don't have health insurance and don't have the means to access integrative health, and that's also available through our website. So we're going to go to the website to show you a little bit of how it looks and make it. Hopefully Audrey could do this. Let's go to the first there. So if you go to the URL, this is where you go into, and you can see on the top we have the competencies news for educators and health professionals, and then we have a patient portal that is still in process of being built, and then the course. So in terms of the competencies, as I had said, we came up with 10. We thought 10 is a good number. There's 10 commandments. It's kind of a nice round number. And then you could see that after we develop with input of all disciplines to have these 10 meta competencies, each discipline that collaborated have their own further development. So for each meta competency, they have their own discipline-specific competencies that they develop. And let's go back to the previous page. You could see there's physicians, family medicine, internal medicine, pediatrics, preventive medicine, but also nursing, pharmacy, public health, physician assistant, behavioral health, acupuncture, and oriental medicine, chiropractor, and naturopathic medicine. And we reach out to other disciplines that might add later on, like dentists and nutritionists, but these are the ones that really wanted to work and develop their own. This is, if you want to use any of the materials and the patient education and other resources here, you need to log in or create an account. For the patient education materials, this is what Audrey's pointing out. And the course, I think we'll go back to, do we go back to the presentation, or do you want to show something else?
We just want to show what we have so far.
So in terms of patient education materials, again, these are the ones that we have. Since we're here, I'm going to say a couple of things about these. So we developed, there's going to be 40 that are under development. These are the ones that are completed in English. There's going to be in English and Spanish. We also made sure that the literacy level is low because, as you know, especially in primary care, taking care of underserved populations, the reading level is about 5th to 7th grade. Anything higher than that, a lot of people will not pay attention because it will be hard for them to understand. So we made it at a level that most of our patients could understand. And like I said, it's both in English and Spanish. All right, we're going back to the presentation. Like I said, there's newsletters, there's competencies, there's events where we're presenting There are links to partner organizations. We have the patient portal for patient education materials. That should be provider, and this is patient portal. Anyways. And then the practitioner network for the underserved. This is something, like I said, Dr. Spar is working really hard on this and trying to get more practitioners to sign in. The idea is he started with the Bravewell collaborative grant, and the idea for him is to start in 4 big cities. It's Portland, LA, Minneapolis, and Boston,
New York.
And New York. But the idea is once those are developed to create a kind of a national network. And so if you're interested, especially if you are interested in becoming part of this network, you can go through our website to their website and sign on to be one of their providers. All right, so we wanted to, one of our main products or outcomes from this grant, to have something that could be used for training and also for continuing education at different levels and for different professionals. So we created this as a truly interprofessional course in integrative health taught by an interprofessional group of people. And it's, you know, our center, we are very experienced in having a web-based education. So it is web-based, it's distributed learning, and it's people in many places in the States or abroad are able to access these. We wanted to make it fairly available. So we set 45 hours. When we went through our CME, the continuing medical education, and could continue for actually physicians, pharmacy, and nursing, the organization that went through that said, well, it's really, we think it's really 35 hours. So we are calling it now 35 hours of online content. The reason we chose 45 hours to start with is usually that's 1 unit credit for graduate education or, you know, education in general. But we wanted to be consistent with our continuing education credit hours, so we are calling it 35 hours now. So we based it on the competencies, and we also did a needs assessment for content areas and curriculum priorities. So these are the competencies. I'm not going to read through them, but I'm just going to highlight a couple of things. If you work in integrative health, you'll be familiar with a lot of these areas, especially the ability to facilitate behavior change. You know, we work on an empowering of the client or patient model, and for these, behavioral change is a very important piece in how we provide integrative health. We also wanted for people to be able to work well interprofessionally. And the other really important thing is we wanted to emphasize self-care. This is something that medicine is addressing because it's been forgotten for so long that a lot of people are leaving medicine, or there's a lot of kind of mental health and issues, suicide, and among physicians that we're trying to prevent, both physicians in training and physicians in general. So I think it's important to, especially from the integrative health point of view, to use what we know about what's good for health in general and apply it to ourselves. So there's an emphasis on that. And the other one thing that I wanted to point out is integrative health has been mostly one-on-one, and we haven't done a lot of population-based type of management. And because we focus on prevention and we want to partner and collaborate with public health professionals, we made this also one of our competencies to know how to work in community settings and the healthcare system at large. So those are some of the highlights of these competencies. Next. these are, like I said before, these are the professions that develop their own competencies. So our needs assessment, do you want to?
Just briefly, we wanted to just sort of highlight the survey respondents and a couple of results from the needs assessment that we conducted in order to create the course. And basically, we wanted to demonstrate actually a great response. We had 422 people who responded to our request to complete the needs assessment. But it's a very broad distribution in terms of primary care backgrounds, training, and fields. So almost 40% were from the licensed complementary and integrative health education programs, and then primary care residencies, but then also nursing, pharmacy, public health, behavioral health, midwifery, and physician assistant. So just to give you an idea that we really did get a broad response from the people we sent the survey to in order to get their take on what we should include in the course. And then just very quickly, we asked two different ways. We gave them, presented with a list of content areas in terms of what would be important to cover. So these are them rating from 1 to 5 how important, and we've highlighted the top 6 that were rated almost at 5. The means it went on a scale from 1 to 5. So basically, practitioner-patient communication, patient-centered care, nutrition and diet, behavior change and patient motivation, physical activity, exercise, and lifestyle counseling were the top fields. But everything really had fairly high ratings in terms of importance. The lowest was energy medicine at 3.3. And then we also said, okay, you can only pick 5 areas that you would include in your course. So these were, once you see it just maps onto the means, but these were the number of people who put nutrition and diet in their top 5, patient-centered care, physical activity. So it's the same top 6 that came across in these results. So this helped us in terms of focusing the conduct between the competencies and the needs assessment results. We could make sure that we were meeting the needs of who we wanted to offer the course to.
Okay. All right, so course content and pilot study. We call the course Foundations in Integrative Health, and like Audrey said, it's a response to those meta competencies and to what people wanted to learn more about. And so the course as a whole, it has 6 units. One is a brief introduction to integrative health in primary care. This is an introductory course that we have in most of our programs, online programs, just for people to get into the mindset of what integrative health is. The second one, because there was so much that people wanted around prevention and lifestyle behavior counseling, we have a whole course on motivational interviewing. This is very interactive with videos that are analyzed by a behavioral health professional who's an expert in teaching motivational interviewing. So this has been a really good course, again, for many of our programs have these. Third one is healthcare professional well-being. This is what I was talking about, self-care. We call it healthcare professional well-being. It's only about 4.5 hours. It's centered about kind of looking at oneself and the concept of resiliency. Not so much. We talk about burnout, but we may talk about resiliency because I think that's where we should focus not on the negative, but in the positive and how to increase the positive. And then the practitioners go through the course and then pick one practice that they commit to do for 2 weeks around self-care, which is journaling around gratitude or the meaning of one's work. And then the other one is meditation, and then they have a reflection on that. And that has been a really good addition to our courses. Again, we have it in multiple programs, but it's also part of this. And then the next is the next 2 we divided, kind of working one-on-one with patients in terms of assessing and intervening. So the first one, addressing patients through an integrated lens in primary care. We experimented, we usually have videos in the past, and this time we experimented with animations, which gave us a lot of flexibility. So these are real people audio, and these are actually the providers that wrote these sections. So we have nurses and pharmacists and behavioral people, pediatrician, internal medicine, family medicine, acupuncture. So we have a multiple professionals, no, an naturopathic physician and acupuncture here. We have acupuncture and interventions. So it's a fun way to learn the different ways of assessing parts of health. For example, there is how to assess sleep, how to assess nutrition, how to assess what botanicals they are taking that might interact with medications, etc. And then integrative interventions, we have two cases. We're very, again, experienced in doing case-based instruction. So there's two cases, an adult and a young, an adolescent young adult. We have multiple integrative providers to have input in how to approach these patients, and then the learner puts together a treatment plan with an integrative focus. And the last section, course itself, this was also something new for us. Because we again did a population-based case, and this is how to look at a county that has a north and a south, and there's health disparities with the people in the north versus the south based on socioeconomic status and race and ethnicity, and it's how to put together a diabetes prevention program. So using an integrated focus. And then the final reflection is not a course, it's just a reflection that the learner puts together how they would change the way they practice their profession, having learned about all these aspects. So do you have time to show a little bit of the course?
I think so.
Okay.
Dr. Lebensohn, we still need you to move a little closer to the mic.
Oh, sorry.
Okay, so here's the course.
Are we live there in the course? Okay.
Right.
So this is the way the course looks. I'm not used to a mouse, but I'll try. This is just an orientation, orienting to the course. This is introduction in primary care. So let me show you a couple of things of the navigation. So we try to include audios and videos when we can, and there's a lot of, I'll show you here, but there's a lot of these where we ask a question to the learner. The learner writes, this is about, this is the introductory course, how do you find health in your own life? What does it mean to be healthy to you? And then they write these, and once they write, they had a possibility to read what other of the learners, these are all the people that participated in the course, and they could click on any of them and have a sense of what other learners, because these are people in different professions that are in different parts of the states, and it's asynchronous, so people are doing the course in their own pace. This is the course on prevention of lifestyle behavior change. So motivational interviewing, you could see all the different pieces, and like I said, the videos here, we have a motivational interviewing for smoking cessation and a more traditional interviewing on which all of us are very used to do in terms of doing appropriate counseling, but it's not as activating as the motivational interviewing. So there's these two cases, and then there's a dissection of the two cases in terms of what it means to do motivational interviewing versus not. the healthcare professional well-being. This is the one about self-care, like I said. So like you see, they do a self-assessment, which is a resiliency. Is it a resiliency here, or?
Yeah.
Yeah, the resiliency, where they get a score and they can reflect on that. But then we talk about wellness. This is another inventory. This is more to come up with their own wellness plan. Talk a little bit about burnout. As I said, we don't try to focus on the negative, but then resiliency, mind, spirit, and the resiliency practices is what we ask them to do. So let's see what else I wanted to. I'll show you one more thing and then we'll keep moving. But so like a couple of the other, so this is the assessment, patient assessment. So you could see all the areas: spirituality, environmental health, botanical, sleep, stress management, nutrition, camp therapy. So this is a really comprehensive, and it's all in animations. Let's see. Oh, no, it's the other one. I'll show you a little bit of this one. So anyways, just a little taste. I don't want to bore you with this, but when you're doing it on your own, it's kind of fun. And there, like I said, there's a lot of things that we can do creatively in animations that you can't do in the videos. Finally, I wanted to show the integrative interventions. So for example, the adult case, and so you could see these are all the professionals that will have a part of it: pharmacists, physical therapy, psychologists, sleep, massage therapists, mind-body, dietitian, acupuncturist, chiropractor, and dentist. So all these professionals have input, and then the learner can put in treatment plan together after reviewing what each professional has offered for this case. So it broadens their, let's go back to the PowerPoint. It broadens their view of how the tools that they have to approach a patient. All right. We'll try to go quickly to the end, see if there's questions. So Audrey will tell us about the results of the study.
All right, so, and some of you may have participated as pilot sites. We proposed a pilot study of the course to get feedback and to evaluate it as part of the grant. We expected maybe 100 people and 6 sites, as you can see from this slide. We got kind of a little bit more overwhelming response. There ended up 79 sites, over 2,300 participants across 22 specialties. We had educational sites where a little more than half of the course participants, but we also were approached by a healthcare system, a community health clinics, asking if they could train their staff and clinicians in the course. So that was also unexpected. And then we also offered the course to sites where other faculty members wanted to take the course. Perhaps they were did not have a foundation in integrative medicine, and the department wanted to start bringing integrative health principles into their teaching. So we had about a quarter were faculty members going through the course. And these are the different types of sites that we had, and the number of enrollees across the various sites. And this is our completion rate. So we had 679 individuals who finished the course. So 22% in clinical sites, and there's a little footnote there, and a little over a third in the educational sites. We did have some people withdraw from the course. But for an online free course, this is pretty consistent with the types of completion rates that we see. And one of the clinical sites, unfortunately, about 2 months prior to when they needed to complete the course, there was a strike. Nurses went on strike, so I think that's why that rate's a lot lower than what we would have probably seen. So at the end of each unit that Patricia presented, the different units in the course, we have the participant complete a quick evaluation. So this is part of how we give feedback and revise our courses. So we ask if we met the objectives, was the depth or level of challenge of the course, appropriate, how useful was this material to patient care, were the resources helpful, were the reflections helpful, and were the sharing reflections helpful. Patricia demonstrated the reflections, showed you that in the course. And then we just asked about the ease of the online technology. It's an online course. We want to make sure that the experience is seamless. So this is the ratings averaged across all 6 units, and they're really pretty good. So it goes on a scale from 1 to 5, and we have a lot that are at 4, near 4. So we were very pleased that the learners had a good experience with the course. And then we also asked for, at the end of each unit, should this unit be mandatory? Should this be incorporated into required training at your site? And these are also very positive. So the yellow bars are the yes, it should be mandatory. So range from 61% or 59% to 72%. The highest was the healthcare professional well-being. And then the community settings, the public health population approach was a little bit lower. But still, overall, it was very high. When you look at the light blue bars, that's how many said no. So we had some maybes in there. And when you combine the maybes with the yeses, or just look at the percentage who said no, it was really very low. So we were also very pleased with these results, that most people felt that these units were very valuable and should be included in training. We also did a final exit survey. So at the end of the course, we just want to get their perceptions in terms of their experience. So we asked, to what extent are you interested in applying these principles in your practice? To what extent do you want to continue to seek integrative medicine or integrative health education? Did the course enhance your educational or clinical experience? Would you recommend the course? And then would you visit our website? And you can see, once again, the means are all very high. So we had a very positive response to the participants who completed, from the participants who completed the course. And then we asked, so one emphasis that Patricia mentioned is the making sure that we teach self-care, provider well-being, self-care practices. And we asked if they incorporated anything new into their life based on what they learned in the course. And 2/3 said yes, that they had incorporated new self-care practices based on what they were learning in the course. And the last question was, how should we offer this? How should this course be offered? This is a pilot study. We want to know how to offer the course going forward. And most felt, or 45% or almost half, felt that it should be incorporated into general training, required for all, that this should be, part of what's required at their site. And then the other 38% thought it should be offered as a CME option. 17% said it should just be like a track or to those who are interested. And only 3 people who completed the survey thought that the course should not be offered. So these are also very positive findings. In addition to evaluating the course, or we also wanted to look at, are there any changes in the learner from taking the course? So we did some pre and post surveys just to see how do they change, how does the course impact them. So one we also mentioned is the focus on resiliency and the self-care. We do a pre-post within the well-being unit, and there's increased resiliency before and after taking that unit. But also we did it pre and post the whole course, and that also changed significantly, improved at the end of the course. We used a physician empathy measure that also improved following the course, and we also had just a general well-being where they rate their sort of overall well-being and physical, mental, and spiritual well-being, and that also improved after taking the course. There was a measure in terms of their ability to utilize self-care practices, that improved. And then we asked about specific wellness behaviors, and we saw increases in exercise, mind-body behaviors, days enjoying work, and sleep. We asked about how often do you feel overwhelmed at work. That decreased following the course. And then there was a few items where there were no changes: diet, prayer, healthy touch, some of the socializing variables. We also looked at a measure of interprofessional learning or interprofessional practice. There was 2 different measures depending if it was a clinical site or an educational site. So at the clinical sites, there was an improvement in their attitude towards healthcare teams overall, but also their perception that utilizing an interprofessional healthcare team would improve the quality of patient care. In terms of the educational side, it's more that it measured that they view interprofessional learning as having a positive impact on their professional identity, and that improved. And now the revised course is up online.
So we last semester we had the pilot, which you
Patricia, can you get just a little closer?
Yeah.
Sorry.
Yep. So the results are from the first semester we offered the course, and so this semester we offered a revised course, and we have the course free of charge through 8/31/17. That's the end of our grant. We were hoping in a different world that we would get more funding, but the way things are, you know, there will be possibly major cuts to HRSA, so there's really nothing in the horizon that will allow us to continue the center as it is, but we want to continue to offer the course, so there will be a cost to it after August 31st. In addition to offering the course the same way we did the pilot, we're also hopefully in May, we're waiting for our CME approval, CME, CE, and for nursing and pharmacy. But we are going to offer the course in their unit. So the first and second unit together as one, because it's a short. So the introduction with the motivational interviewing lifestyle course, the assessment, the well-being of the provider, the interventions, and the community will be all offered individually. So, and there will be continuing education credit attached to it. And we are crossing our fingers that by May it's going to be available. We have to do some revisions. The other interesting thing is the continuing education that we were able to obtain is a interprofessional continuing education, and that's why it's taking a little longer, but we thought since this is a very important piece of the project, we want it to be like that. And like I said, these are the 5 courses that are going to be like standalone units for individuals that only want to take a piece and not the entire course. And this is our contact information, and I think this is it, and we're open to questions.
Right.
So the one thing I did want to mention, and thank you both so much, and I do urge everyone that is on this webinar to go to the website, explore it, send us any questions that you may have, is one of the things that I thought was very interesting, and then we'll open it up to many people for comments, was how many faculty actually did the pilot course. I think many of us were very interested in that element in particular. And then another kind of backstory issue is that when we first came together to develop the competencies, it was a pretty amazing chemistry of so many different people at the table who've really been devoted to this area for decades, now working together in harmony and with some good academic debate of really coming up with the meta competencies as well as the content pretty quickly. So another element for all of you on the webinar, I think, to consider is if you know individual practitioners, either in conventional medicine or in the integrative health disciplines, that you are thinking about approaching, that you may wish to work with, or at a local hospital or at a local integrative clinic, this is a really excellent course the moment it is open to individuals to give many practitioners, even administrators, which is what Alina did, a good background, basic knowledge. It doesn't go into training scopes of practice and things like that. It's not really an interprofessional education at that level, but it does really show and demonstrate about collaborative team-based care. So I think that I know some individuals now that are using it that way. They've been in discussions and they've hit a few roadblocks because, there's still quite a bit of ignorance out there in a sense, and just a lack of time of people understanding what integrative health is, or interprofessional education, or the focus on health. And I think this course in particular is a really nice way for either academics or persons in hospital clinic settings, learning more of the basics so they'll feel comfortable both with a dialogue, but I think it can be, the course could really be used to open doors, open doors in your local areas. And I also know that both Audrey and Patricia, are very available to work with you on it. John Fennell, I know, was about to be talking to a clinical setting, and Audrey was able to get him into the course and reviewing it in a very short amount of time so he could really go in and present on it at a different level. So do either of you have anything else you'd like to offer on a general, at an overview level, or a general area of might be of interest? I know for the group, we really enjoyed working together. We've talked about potential future projects like focusing in faculty development, collaborative faculty development. Another area that's come up that we have barely tapped on is around the issue of when you're in team-based care, what we call the hidden curriculum. So how do you hold good academic debate? How do you disagree with each other? How do you decide, who is doing what? I mean, those are all certainly areas as well that, especially in the integrative health area, really could use some more, kind of deep thinking and think tank kind of approach. So Audrey or Patricia, do you have anything else at the more of what I would call an overview level about the course? And then Renee, I don't know if we're able to do it because we actually ended up having fewer people on this webinar, and we understand everyone is so busy. If you don't want to type in the question, are we able to unmute individuals at this time or not?
Yes, we have about 17 people on right now. If you want me to unmute people, I can try. We might get some feedback, but we can try it.
Oh, yeah. People should stay on mute unless they're talking. But if people, if you want to type it in, great. But if you want to just talk, why don't we try it? Yeah, people can go on mute, but then come off mute if you have a question. We have a little more time, and this is a great time to ask questions. So it sounds like the course for individuals might become available in May. And then, again, there will be no charge until the end of August. Is that correct?
Yes, yes.
Okay, great.
And we will be announcing once we have a date. We'll be sending out a newsletter, and we have also have a mailing list on our NCIPH website, so that way you would get announcements of the course, or as the practitioner network becomes more developed, or as more patient education materials become available, you'll receive notifications. And I would encourage you to check our website for those, because we are still working on those resources.
And again, I think for many of the CIH providers and people involved in the collaborative world, quite a bit of it, but I think you'll be surprised and also learn something. And also the way it is presented is very user-friendly and interactive. And again, I think it's an excellent educational resource that you can also be showing your students. So, okay, I have said enough now. And are people on mute still, Renee, or are they off?
They're off or they're self-muted.
Okay, so does anyone else have a question about this course and its availability? And
who hasn't? Hello, Kitty. Have we all done that? Unfortunately, because it's public.
And so please only take your, leave your phone on mute unless you're asking a question. Does anyone have a comment or a question?
One question came in.
Okay.
Can you put the source page back up?
Which page?
Which
The web page?
Sorry, the web.
I don't have control.
NCIPH, you don't have control?
Oh wait, well my computer's. Oh, apparently let me try one thing. All right, there we go. Sorry about that. Did you want to look at the course or at the NCIPH website?
There's Claudia. Nope.
Oh,
Yeah.
here's questions. The source. Oh, okay.
The source. We need to know what.
Oh, you want okay, I'll put back on the website and Patricia will answer the other question.
So, any comments on its value to licensed professionals versus to members of conventional?
You have to get closer, Patricia. Sorry, I have to keep reminding you.
I need to move the computer. In terms of, so I think, of course, this is usually more news for conventional practitioners. On the other hand, I think because it's not just physicians that are teaching, it's also nurses and pharmacists and nutritionists. I think everybody has a chance to learn something from all the professionals that are teaching. And the other, I think, important thing is, how to work together with one patient. So, for me as a physician, where can I consider incorporating a chiropractic care or acupuncture or nutrition? But on the other way around, what does a physician or a nutritionist or a nurse or a school nurse have to offer for a client or patient that a CAM practitioner would be taking care? So we don't, the course is more, it's very foundational, and it's not so much, how do you take care of X health problem in an integrative way. It's more, how do you incorporate integrative health into primary care? And the cases are a way to show how you incorporate and how you work as a team, but not so much, the patient has TMJ and have fibromyalgia, but there's not a course on fibromyalgia or in TMJ, but you could hear a dentist saying, what they have to offer for somebody who has pain in the sides of the face because they're grinding their teeth at night. So it's, I think everybody learns, but at the same time, this is very foundational. This is not a high level, how to take care of X medical or health problem. And I couldn't. Yes.
Just to add to that, Patricia, so I think what Patricia is saying is very relevant, and that's one of the reasons I mentioned that if you know of individuals either in the integrative health world or in the conventional medical world that perhaps have less knowledge and expertise, than you may have, this is a wonderful course for them. But I also found that with myself taking it and having been involved in this area, not as a practitioner, but as an educator, for about 30 years, I both learned about elements, but I also felt that how I could present this now, both to my students and to the faculty, was very helpful. And I do think that, looking at it, where we have much more learning to do, particularly in the integrative health area, is around team-based care.
Okay. We have another question. Do you know of patient-centered medical homes or federally qualified health centers that are routinely using this curriculum?
Yes. So yes, and actually we want to, so that's one of our clinical sites for the pilot phase was the Orange County Coalition. So there's some clinical practices, but also several community health centers. We think this would be ideal for community health centers to do if they have residents, to train their residents, but also their staff, you know, from nursing to pharmacy to physicians to PAs to nutritionists. Every professional that works in community health centers could definitely benefit from these and have, you know, work together in having an integrated health approach. So absolutely.
And let me just also, David Vogel's clinic, Casey Institute, we know is actually going to be requiring it of everyone who works at his integrative clinic. So sorry to interrupt you there, Audrey.
Okay. What I was going to say is the way the Orange County Coalition did it, they have about 5 to 10 federally qualified health centers, and they received funding to make integrative healthcare sort of the standard in all of their clinics. And part of their approach, they're doing a multi-pronged approach in terms of training, but one was to use this course as a foundation with their clinicians and their staff so that everybody has a foundation in integrative healthcare and they get everybody sort of on the same page. So that was a clear example of how they use this course to begin changing healthcare at their sites. Looking to see if there's another question. All right, yeah. I think that's it. I don't know how to make, sorry, I don't know how to make this bigger. It was somewhere else before. Let me see, let me try that. There it is, sorry, okay.
Can you put this source page to your patients and
yeah,
the information with the websites and phone numbers and let's go with that. Okay.
Okay, any other questions?
Or comments?
Or comments? I have a question. Is anybody who's on the call, did you participate? Were you a pilot site or did you participate in the course the first time? I know we did have some complementary and integrative health programs participate. I was just curious if anybody on the call was involved in the pilot. I guess that's a no.
I thought NUHS was, but maybe not. And they're all muted.
Yeah.
Yeah, I'm not
Okay.
sure. I'd have to look it up, you know, in Minnesota. But maybe not.
No, I don't think they were.
They weren't, yeah. Yeah, we must have had, how many, do you remember how many we had? It was quite a few that did participate.
I don't remember the numbers, but there's at least a couple hundred. We had Bastyr, we had Oregon College of Oriental Medicine, we had maybe Palmer College, so, and there was others.
Yeah, that's why I was thinking it was more than a half a dozen, I thought. But yeah. So we did have, I think Western States too, University of Western States.
Yes.
There are a couple more questions. You pull up your question panel.
Here. Okay.
No, do you know? Yeah. I'm interested in taking individual course, director license. Great. As soon as we have the continuing education, it will be available through the website.
Yeah.
I don't know what else to tell this individual, Audrey.
Yeah, so they're doing the sort of final review of the course on April 24th. So that's why I'm estimating that we should have the course up online. We would just need to make a couple tweaks on our end. The course is ready to go. We're ready to launch. We're just waiting because we'll need to have this certification and languaging and things like that. So I'm very hopeful, since they're meeting April 24th, that we'll be able to launch the course within the first 2 weeks of May. And like I said, make sure you're on our email list. Go to the NCIPH website, sign up there, and then we will send out an email blast notification with instructions in terms of how to access the course, that it's available, and so we're really hoping for May.
And we'll send it out as well, as far and wide as we can.
We'll send it to Liza then, and she'll send it to everybody.
Right, and she can also post it on the collaborative website. Can also put an announcement there.
And Liza, you've been asked to comment on the role of ACIH in developing the program.
Oh, I'd be glad to. Actually, we had a very broad level of development participation. So the first thing is that the collaborative was asked to be part of the leadership team, and I've attended each of the annual meetings and been on virtually all of our monthly conference calls. But one of the things that happened is that when we developed the meta competencies, and as you can recall them, both Audrey and Patricia talking about it, we actually had the 3 disciplines that we included in quote unquote primary care provider in the broadest division. And this is the first time HRSA has recognized us at that level, which was chiropractic, naturopathic, and AOM. We had 3 individuals from their councils of colleges create their sub-competencies for their disciplines and give feedback on the meta-competencies as well. So there was very broad input from the collaborative, from the board, and as well as from various councils of college members, really throughout this last 2.5-year process. So both in the meta-competencies, in the competencies, in the content itself, and then in discussing which kind of providers might be appropriate for the various cases. So it was it was an unusually collaborative, interactive situation, and I think that it really demonstrated in many ways how we can move forward into the future, and what an excellent product can come out of this level of collaboration. So I would often bring together the teams and then be sure to represent them. We had input from our executive committee, from our full board. So there was really significant input from the collaborative. Did you want to say anything more about that, Patricia or Audrey?
No, I think you said it fine. I think the idea is to be as inclusive as possible, and there's always language, there's always, our professions, we use, medicine or patients versus clients, but those are all just, more superficial things, and we keep working on them. I think the main thing is that it was a very inclusive process where everybody had equal, participation and say, and we tried to demonstrate that having all professionals teaching the course in the online course, so everybody gets exposure to everybody.
Yeah. And again, I think you can take note on the feedback on the course, which did include, I think, at least 6 of our colleges. It might even be more. The feedback level, including that means from all of our attendees, was actually really high. I mean, it was really strong. So I think that's important to take into consideration as well.
Right.
Okay, I think we are there. So this has been an excellent webinar. Patricia or Audrey, do you have any wrap-up statements that you would like to make?
Not working, and we're going to work on with the web team to address it.
So thank you all for being on the webinar. We will end up posting it on our website, and we'll then send it out. It looks as though this generally happens kind of, as in what we noticed on the course, that X amount sign up and X amount show up. So we will certainly post this on our website, and we'll also get it out to all the individuals that were not able to attend. So thanks again. And our next one which is going to be on our work with the, used to be called the Institute of Medicine. It's now the National Academy of Medicine Division of Health and Medicine. I think I have that right. It's not quite right. You know, the Global Forum for Innovations for Health Professional Education will be having presenters on that project this coming May. And it's really taking some of the pith information that we heard today about resilience, health, and well-being at an organizational and individual level to an actual workshop that the Global Forum will be holding in DC in 2018. So we'll send that all out to you. A reminder on when that webinar is. I think it's May. You have that, Renee, handy? I think it's May. I'd have to look again. I think it's May 18th, but I will get it back out to you, and you'll have your opportunity there. So we really wanted to share our national projects with you all, and I think this one has been really excellent. So thank you so much, Patricia and Audrey, for being on the call with us today.
Thank you.
Okay, bye-bye, everyone.
Bye.